For today's exercise, I'm going to eat crow. In this video, I'm going to show you why you can take everything I've told you about your low back pain and throw it out the window. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro. And as I said in the introduction, in today's video, I'm going to eat crow. The reason why is that in previous videos, I've talked on and on about how much we flex. I pointed out that researchers went around counting the time in a day that a person bends their spines, including sitting, and that they came up with a number that was around 4,000, even higher than 4,000. And so because of that, I told you that the two most beneficial exercises for you are going to be extension and lying, my personal favorite, my desert island exercise, or extension and standing. However, those don't work for everyone, and in cases, those can even make you worse. So if you've tried extension and lying or extension and standing and found that you become worse when you do them, or there's no benefit, then I'm going to show you this. So in certain cases, even though we're flexing so much and sitting a lot, some people actually need to flex their spines to get better. And in today's video, I'm going to show you just how to do that. In this video, I'm going to show you flexion and lying, which is basically the opposite of all the extension-based exercise I've showed you in previous videos. So as the name implies, we're going to do this laying down on our backs. So this is called flexion and lying. So we're going to be lying on our backs. And what I want you to do is kind of have your feet together and your knees together. And then what you're going to do is lift your knees into your chest. And at the end of that, you're going to hug around your knees and pull. Hold 1 to 2 seconds, and then back down. So knees come up toward the chest, pull, hold 1 to 2 seconds, and then back down. Knees come up into the chest, pull, we're trying to get as far as we can. Remember, end range is where the magic happens. And then back. This hug is to get you to end range. You're not going to be getting there here for most people. So up, pull them in, hold 1 to 2 seconds, and then back. Each time you try to go farther and farther and farther. Most people say that when they do this, they feel a good stretch or a pull. It feels like it's opening things up, which in a way is exactly what it is doing. You might have a little discomfort. What should happen, especially if this is the correct exercise for you in the correct direction, is as you do more, it feels better and better, meaning less pain, and your motion is feeling more full and more free. A modification, if you're not able to hug around your knees, because for some reason you don't have the arm motion or the hip motion, or it hurts your knees, you can actually hug behind your knees and pull this way. Same thing. Knees come up toward the chest, grab behind the knees, pull in, hold 1 to 2 seconds, each time getting farther and farther and farther. The dosing for flexion and lying is 5 to 10 reps every 2 to 3 hours or is needed for pain. So if you can go longer without your pain coming back, you can push that a little longer. If your pain comes back every 4 hours, then do it every 3 hours. But it might be shorter. If your pain comes back every 2 hours, then you're going to want to do it every hour, hour and a half. 5 to 10 reps every 2 to 3 hours, generically speaking, or is needed for pain. Always test these exercises out. If it was painful to stand or to get up from a seated position or to walk, test those things out. Does it feel better? If it feels better, bang. This is probably a good exercise for you. If it feels worse, then I want you to go back to the extension-based exercises. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro with Flexion and lying. If you like what you've seen, subscribe to our YouTube channel and click the little bell so that you'll be notified each time we upload a new video. Like the video, share the video with your friends, and leave comments below. Let us know if you've tried this exercise and if it's worked for you, or even if it's not worked for you. We'd love to hear from you.